Dr. Sanchez here. I'm a chief general surgery resident. That means I'm a 5th year general surgery resident. Thank you for coming back to my channel. Today we're driving over to the hospital. It is a little before 7 a.m. I know it's a miracle that I got to sleep into this time. But we have our ABSITE exam, which is our American Board of Surgery in training exam, this Friday. We actually get the 2 days before the exam, not off, but like off from clinical duties so that we can have an ABSITE boot camp, which is basically we just cover high yield topics, do like a final high yield review before the exam. And this whole thing is resident run. It is at the hospital, so I'm driving over there. We get like one of the auditoriums and we just kind of put up PowerPoints and go through. I know people are going to be like, oh my God, like I can't believe that you get the 2 days to study before this exam. Well, I think it's very progressive of my program and I think it's really great because honestly, I know that some of the older attendings or some of the older surgeons have different views. They're like, I didn't even sleep and I took the exam. I was half asleep during the exam. I was on call all night and then I took the exam. But let's be realistic, guys. Nowadays, to get into a fellowship, especially a competitive fellowship, I think it is very important that you do well on this exam. It's just something they look at. You're not going to care that you were on call the night before every exam if your exam grades are absolutely terrible. So you have to do well. I honestly feel like the scores just keep going up as with all standardized tests. I don't know. Are people getting smarter? I don't know what's going on. We are getting a coffee before too. Whatever it is, I'm just thankful that some things are getting better and that we're recognizing that surgeons are human beings too. We need sleep. We need all the normal things that humans need to feel good and feel normal and be well. Also, I will be taking my general surgery board exam this year, so I'm using this kind of as a practice. I mean, obviously I've already matched into fellowship. However, I do want to do well because I need it to give me some confidence. I can go into my general surgery boards confident, which I will be taking later this year in July. I pretty much finish my general surgery residency and then I start fellowship right away, and then 2 weeks into my fellowship I'm going to be taking my general surgery board exam. General surgery boards have two parts. There is a written part that you have to pass first. You sit down for many hours and just stress out as you take this giant exam. This is what our ABSITE exams are to kind of prep us for. The second part is oral boards. I'm very scared. Oral boards are basically just these really intelligent older surgeons, well I assume they're older, I don't know, pimping you, aka asking you anything and everything about general surgery. They basically give you scenarios from what I hear. They'll tell you you have this 40-year-old patient present with these symptoms, what do you do next? And then you go through your workup, you say what labs you would order, what imaging studies, what you would do next, and you have to just verbalize all of the things that you would normally just do. Which to me, the talking part is not the stressful part. I feel like I'm pretty good at talking. However, it is stressful to know that they could ask you about anything. Any scenario. Any case could be thrown at you that's within general surgery, which covers a lot of things. So to me, that's the stressful part. You have to know all the steps of the operation. You have to be able to walk somebody through the operation as if you're doing it, so in a safe manner. It's a lot. I don't even know when I'm gonna study for that. I think that's in October, and you have to pass obviously the written board exam first to be able to qualify for the oral boards. And once you pass the oral boards, then you can finally say that you are a board certified general surgeon. And this is kind of where this like dual board certification thing comes from. When I finish my plastic and reconstructive fellowship, I will also take plastic and reconstructive surgery boards. And so I'll be dual board certified in general surgery and plastic surgery. The term is double board certified, not dual. We got ourselves a coffee. We have my giant water bottle. I need this to get in the hospital, and then all of our essentials in here. Computer, little lip balm, like 5 of those, some snacks, a little Creed sampler because this just makes me so happy. Smelling this just makes my day. I feel so good. It honestly doesn't take much. I got a good workout in. I feel nice. Like I need this. I need this balance in my life. I need to be able to work for a little bit, get a good workout in, get home before it's dark. This makes me feel good. Tomorrow we also have just dedicated study time. Thank the Lord, because I need it. I honestly just need to de-stress. I don't even know how much studying I'm actually gonna get done tomorrow, but I need the time just to de-stress, because I feel like when you take an exam, you should go in there clear-minded, well-rested, de-stressed, and that's how you're gonna perform well. Not if you're tired as crap, you've been up all night, you're stressing out, you're gonna get things wrong. Not to mention, I feel like this is the first good workout I've gotten in like the last month. Somehow I thought this rotation, so I'm on a general surgery rotation right now, and I thought it was going to be a little better in terms of work-life balance, but it has been nonstop. I'm there late the days that I'm on call. I'm there late the days that I'm not on call. I seem to just always be there. I get up really early. I'm just chronically tired, and I've been pushing myself to come to the gym. However, every time I come to the gym, I feel like I'm so tired from the day that I don't get a good workout in. Like I don't have enough energy, even with an energy drink, to get a good workout. Today, I finally feel like I had it in me to get a nice workout in. Feels so good. I don't need much. It's just simple things. Just some sunlight, a good workout, a nice meal. I'm gonna go home now and try to do some more practice questions, maybe make some dinner. I think I might make it to my daughter's swim lessons today, which I haven't made it in since she started. I think I've gone once. I'm gonna go to that today. I'm gonna make some dinner. I'm gonna do some studying. It's gonna be great. Here I've got my energy drink, my water, my snack bar. It is the morning of my exam. It is 6 in the morning. Woke up around 5 something just to get ready because I wanted to take my time. I didn't want to be in a rush. I'm a little nervous, I'm not gonna lie. Even though I used to not get nervous about exams, but now I get nervous about exams. It makes no sense. Like why at this stage in my training I get nervous about exams. So I didn't do a whole lot yesterday. I actually just tried to relax, and then I couldn't study past like, I don't know, once it was like 6 or 7 p.m. I was like, well, there's nothing that I'm gonna learn at this time. And so I started watching the new show on Netflix, Griselda. Unfortunately, after the exam, we have to go back to work, which is the part that I'm not excited about because I feel like I'm dead. I need to rest. I'm tired. Okay, this is for all of you thinking about becoming surgeons. The tests never end. Taking the ABSI, which is the American Board of Surgery in Training exam. It's my last one ever. From here, I will be taking in July my general surgery board exam. This is while I'm starting my new fellowship as well. Then in October, if I pass my written boards, I will be taking my oral boards for general surgery. And in the next year, I will also be taking my plastic surgery in training exam. I will take that for the next 3 years, and then I'll take my plastic surgery boards at the end of plastic surgery fellowship. Sounds absolutely insane because it is. And every time we have to take one of these tests, we pay for it. Well, the in-service exams, I think, are paid for by the program, but somebody pays for these exams. I mean, the audacity to be giving tests to a 30-year-old, and on top of that, making us pay money to take these exams. Just finished the exam, and I get to go back to work. Yay! My brain is so fried. I want to go home. I want to go home. I want to sleep. I want to go on a vacation. Okay, so about the test, I felt like the first part was easier. Like it was basically 2 sections, and the first section was, I think, 2.5 hours, and the second section was 2.5 hours. You're allowed to take a 45-minute break in between if you want to. And of course I took the break. I only took like 20 minutes though. And the second section I thought was a lot harder. In the first section, I only marked a few questions to go back to that I wasn't sure of. In the second section, I felt like I was just marking them all. I don't know if that was intentional. Made me very confused. Had a false sense of, security with the first section. That is behind us. Now I get to wait 4 to 6 weeks to get my score back. I will say, as a chief, it was nice that I pretty much recognized everything that was on the test. Everything was new. It wasn't like, oh, I've never ever heard of this or seen this before. Like, I'd seen and heard of everything. Doesn't mean I knew all the answers, but I at least recognized everything, which I guess is a good thing because I've been here for 5 years. So if I didn't, that would probably be a problem. Back to work we go. Happy Friday. I feel so good. I feel like I've gotten some good workouts in this week. I'm gonna go home now, off this weekend. I'm hoping I can go to the beach or to the pool. I'm not doing anything productive this weekend. No, I lied. I do have to film the TikTok tomorrow that is due. Other than that, I'm not doing anything productive. I'm definitely not studying, at least not for this weekend. Thank you for watching my channel. Thank you for coming back. Thank you for being here. I will be trying to film more of the process over the next 6 months that I have left, or 5 months that I have left in residency. Anyway, have a good night.